Okay, so we're gonna start off with palpations. First, the patella. Inferior, superior, lateral, and medial. Next, we have the patellar tendon right here. Medial joint line right in here. Lateral joint line right there. Tibial tuberosity right here. Distal quads right here. Distal hamstrings and tendons are the backside right here. Lateral femoral condyle right here. Lateral medial condyle right there. Head of fibula right here. LCLs right here. MCLs right here. The ACL and PCL you can't palpate, but they're behind the kneecap. IT band is right here, and then sartorius runs along here. We're gonna start off with the sweep test. We're testing for intrascapular swelling. So you take the kneecap and put pressure around all of it. And next we're gonna do the ball table patella and check for moderate to severe joint effusion. Same thing, but then you tap the top of the kneecap. And then next we're gonna do the bounce home test, and we're gonna look for effusion in knee. So pull it up, and then let it drop. And then we're gonna do girth test.
We don't have to do those.
Well, I'm gonna do it anyway, just in case.
You don't.
Checking for swelling. You measure here and here, just for reference. Okay, so we're gonna check. We're doing the valgus stress test. We're looking for laxity at 0 and 30. So we're gonna take it, push like that, then bend the knee, hold it here, and then do the same thing. And then we're gonna do the Vera stress test, which is the same thing, but on the opposite side, also checking for laxity at 0 and 30. So start with it straight, like that. And then at 30, go like that again. All right, so we're gonna do the posterior drawer test, and we're checking for PCL. So then your knee here, and I'll sit on it, and then put posterior force. All right, next is the posterior Lockman, and we're checking also for a PCL. So put it straight, and hold here, and then put downward force. All right, next is the Godfrey's 90-90. So go down. Put your knees at 90 degree, please. And then like lay down on your back. Thanks. And then you're checking for one resting tibia more than the other. And then there's the posterior sag. So you can sit back up. So flex your knee like that and contract the quad. Contract the quad and push your heels in. And you're also checking for PCL as well with that. All right, so we're starting off with the Lely's test. So you put your fist under the calf, and then you push down, and their leg goes up. You're checking for the ACL to see if it bounces. And then next is the anterior drawer test. So put your knee up, like up, like that thing, and then sit on it. And then you're applying anterior force. And then we have the anterior Lockmans. And so put your leg straight. And you're going to apply force on the distal thigh and tibia. And then check for that ACL as well. Alright, so we're starting off with the Thessaly test. And we're checking for clicking or popping and joint pain. So you're going to have them squat on one knee and then twist. So that's it for that. And then we have the Steinman's tenderness test. So sit down, please. And then give me your leg, one of your legs in the air. And then you're gonna take it around and look for any clicking, popping, or tender. Next is the McMurray's test. So start with inflection, and you put pressure, and then palpate and apply valgus force. Next is the Apley compression test. So wait, can you lay on your stomach? Thanks. And then raise your knee up. and then you apply force through their heel, and then rotate internally and externally. That you're also checking for meniscus, any pain or clicking or popping, and then next is the pinch test. So stand up. Please stand up. Sorry. And then I'm gonna pinch right here, and then squat for me, please, like slowly. That's good. And if there's any clipping or popping, and then hit the duck walk.
Oh. I was duck walking.
Okay, so we're gonna start off with the patella tendon length test. This one you just basically check for the ratio, make sure everything looks right. And then patellar apprehension. And then, so if his left leg is hurt, you want to stay on this side, and then put force laterally from the medial side. See if there's any pain, or if they're apprehensive about any movements. And then for the patellar grind, you have it in extension, and then I'm gonna push the patella down, and then have him flex his leg, like that. Alright, so for the Renee's test, you're gonna put pressure here and have them squat. Squat down. 30 degrees. And you're checking for IT band syndrome. And then land your stomach, please. So you're gonna put pressure, thumb on lateral up, condyle, and then flex and extend. See if there's any pain at 30.